Hi, welcome to Ta Tuesday. I'm Kara Keenan from Going Beyond the Pink, and I'm here bogarting this whole thing from Joy this week because I want to share something really important. A lot of women, when they go for diagnostic imaging, will hear that they have something called micro-calcifications. In fact, that was my own personal story as I was going through diagnosis and later found that I had stage 3 breast cancer. So I'm here today to talk with Dr. B about exactly what my micro-calcifications look like and how they go about distinguishing the ones that are concerning from the ones that aren't. Hey, Dr. B.
Hey.
Hey. So he's going to show us here.
So this is the standard view on the mammogram right here, and you can see we put all these arrows around this area that kind of drew our attention, and if you look really closely you can see these tiny white dots. It's very difficult to see. I don't see a mass and I don't see any distortion of the tissue. We have a compression view here which delineates these calcifications a little bit better, kind of pushes the tissue out, and you can see there are all these little round and punctate white dots right through here. Now you may look at that and say, well, that's not very impressive, but that is what we're looking for with mammograms, and that's why they're so valuable, because these little dots can end up being that early stage of cancer. And that's why we recommend biopsy for these things. But they're very tiny, they're very hard to see. I wonder if we had 3D mammograms back then, if we wouldn't have seen something hiding in that dense tissue. But the 2D views show these calcifications perfectly well. They're small, they're hard to see, but that's what we're trained to do. But that's what they look like.
That's really incredible, Dr. B. To think that something so small is what you're looking for on these images, patient after patient after patient. It's really incredible what you're able to identify and how you're able to help us out. And then I just want to mention, so you talked about in the diagnostic image how the tissue is kind of squished, right? We all have that knowledge about what a mammogram does and how we're in there squishing the breast, right?
Yep.
Well, that's why it's so important, right? You want to talk to us about that, what that does?
Well, the squishing part?
Yeah.
It's not very comfortable, I'm sure, but what happens is when you have that dense tissue, and this was more so with the 2D or the 3D, you get tissue that would overlap. And you put the x-ray through, you get tissue that would overlap. And so we'd call people back because the tissue looked funny or looked distorted. And you do these additional views where you put a different paddle, you could focus on the tissue and really spread it out and squish it. It makes things that are normal go away and things that are abnormal stay there. And so it really is a nice tool for us to decide what's normal and abnormal. Plus, when you have the breast squished or in compression, it's not moving with breathing or any slight change in position, and so that helps us get a beautiful picture, because any motion makes the mammogram blurry, and so that's why we need that tight compression as well. I know it's not comfortable.
But so necessary.
So helpful, yeah.
Well, thank you so much for sharing the information about microcalcifications with us. And I know you all heard him say how important it is to know what's normal and what's not. So let me go ahead and plug that if you're enjoying these Ta Tuesdays, make sure you get in touch with Joy and set up a workshop to learn about what's normal and what's not for your breast tissue. Until next week, thanks for having me.
Ta-ta.